there are certain types of care in the hospital that are never going to leave. So, but we have to do those more efficiently and better. And then we have to really understand how do we take care of that interstitium, everything from being at home to end-of-life care, and we have to heavily invest in that. And as contracts move from more value-based care, that has a tremendous benefit for us. But our belief is we don't want to wait for it to happen. You got to start moving in that direction. You have to do that sooner than later, and we think that's an important area for us to grow in. So home health, for sure. I mean, palliative care, hospice care, ambulatory clinics that really work for the consumer. You can have a 23-hour stay in, a freestanding emergency room, a clinic. But then more importantly, it's the digital space, right? So on average, we spend 4 to 5 hours on our iPhones and our iPads. That's the way we really want to get our health information. That's how we want to manage our health account. So we think it's critically important to invest in the digital space, because the digital space is we're going to manage things outside of the hospital. We were able to get one of the developers that worked on the Kindle project to become our VP, our senior VP for strategy. Now, you want to talk about an organization that has a customer focus. That they are incredibly dedicated to the customer, and they're also incredibly dedicated to the digital experience and understanding what you want. That's the person that we want directing our strategy. And just in the last 3 months that Aaron Martin's been with us, he's really transformed our way of thinking. One of the things that he's working on is that when a patient comes to see us and needs, whether it's their vitamins or anything else, why aren't we taking that retail opportunity with our own patient? And we know who does that well. Amazon does that well, but why aren't we part of that experience for our patient? So it's all of that way of thinking that's really transforming where we're going. The customer word is something that we're all a little uncomfortable with. We love our patients. That's where our heart and soul is. I'm a physician. We always think in terms of our patients. But we've done a disservice in a lot of ways to our patients, because it is about, the key word that we're missing is service. And a lot of the reason why we're all in healthcare is because we live to give service. I mean, that's where we're there. That's our mission. It's to give compassionate service. But how are we doing that? Are we really doing that? Are we really focusing in on the N of each individual? So we have a saying at Providence where we talk about population health, but we have to take care of the N of one, that one family, that one individual. How do you do that? How do you customize that space? So we think that's through the digital world. That's going to be very, very helpful to us. But it's also, how do we personalize our care? So if we're going to be customer focused, when I walk in the door, I want to be seen today. And I really want to be seen politely. And I really want to have as good an outcome as I possibly can have. So we have a saying at Providence: know me, care for me, and ease my way. And we think those simple words talk about the whole experience of care. We also say that they're easy to say and it's hard to do. What really helps us is having had a health plan for 30 years. There are a number of provider organizations that back in the 90s held on to their health plans. Intermountain, Centera, Presbyterian in New Mexico, ourselves. And now that's coming back to really help us, because the whole infrastructure around that health plan is the core for all of our ACO. Instead of starting from scratch, we have a core that understands how we manage health, how do we pay claims, how do we look at risk, how do you look at actuary, how do you look at medical management. We recently changed our theme to creating healthier communities together. And we ultimately believe that our shareholders are our communities, and that we should be judged on how well we deliver care there.